Hi everyone, I hope you're having a good morning. I just want to take a moment to introduce myself. My name is Dr. Erica Grenchi and I'm a naturopathic doctor and a master herbalist practicing in Toronto, Ontario. And I'm so excited to be taking over the Matana Organics feed today. So please send me all your questions and I have a few interesting topics to chat about. All right, talk soon. So, how does my approach to medicine differ from other doctors? So, I'm sure if you've ever seen a naturopath or talked to a few different naturopaths, there is variation in between how people practice, right? So, I actually decided to, even though we learn herbalism in naturopathic medicine, I decided to take it a little bit further because I really resonated with plants and I wanted to get to know them even better. So, I got further schooling in herbalism and I love, customizing my own blends for patients. And herbs are amazing because they're especially targeted to specific organs and organ systems. I love that they're in their whole form as opposed to isolates, and I really have seen their effectiveness time and time again. All right, so how to safely implement herbs while pregnant and which ones to avoid. So, this is a very big and important topic. You want to avoid anything that's too detoxifying, right? You don't want to detox during pregnancy. So, things like lymphatic herbs like red root, blood root, poke root, these would be herbs to avoid because they're going to be too strong on your system. Anything that's cathartic and it's going to stimulate bowel movements, like senna, cascara, buckthorn, you want to avoid those. You also want to avoid anything that's going to cause contractions of the uterus. So black cohosh, blue cohosh, there's really a long list. So if you do plan on taking herbs while you're pregnant, it's best to consult a naturopathic doctor or herbalist who's well versed in herbs for pregnancy. But there are some amazing herbs that you can take and enjoy while you're pregnant and throughout. So what you want to consume during pregnancy are nutritive herbs, right? So things like nettle or red raspberry leaf, which is actually also a uterine tonic, and especially taken in your third trimester, it's going to be very helpful in preparing your uterus for birth and strengthening those contractions. But those are the top two that I recommend as nutritives because they're full of vitamins and minerals. I took them throughout my entire pregnancy. I also added marshmallow root, which is a soothing herb. It's very good for preventing heartburn and just nourishing the stomach and intestines. Alfalfa, which is also an excellent nutritive tonic, and rose hips, which are high in vitamin C. So I did a big tea out of those every day. I pretty much drank a liter of that, and that was my mother's tea blend. All right, so should you consume your placenta? My opinion is that you should not. I do understand how in the wild mammals typically do it, but it's in order to basically fend off predators and get rid of the scent of their newborn. Now, for humans, I mean, your placenta contains a lot of progesterone, and you should not, in my opinion, ingest an exogenous hormone. What you should do, however, if required, is take herbs later on that balance out your hormones, especially if you're feeling postpartum depression. That could be, a thyroid imbalance. So it's really important to look at what things may be contributing to how you're feeling and getting the right nutrients from your diet. And there's other things to look at as well. Winter or summer? I'm definitely a summer person, even though I'm a winter baby. I was born in December. I just love a hot climate, and I'm a beach bum, and I just love getting that vitamin D naturally. It feels so good. Okay, so my approach to supporting women with fertility issues is to first understand if there's an imbalance and going to the root cause of what's going on. So, for example, is there PCOS? Is there a hypothyroid condition? Is there a lot of chronic inflammation from food sensitivities? Is there not enough vitamin D? You know, really going to the root of it and balancing things out naturally through dietary approaches, lifestyle, consuming more alkaline-rich foods and superfoods, and regulating the menstrual cycle, maybe with acupuncture as well, which I also love. So there's multiple ways of approaching fertility. And really it comes down to optimizing your body as much as possible, getting rid of anything in your environment that is maybe an endocrine disruptor and affecting hormone balance. There are so many things to look at surrounding fertility, and it's nice because at the same time that you're doing this, you're also going to feel better. And you know, I see it over and over again. A lot of people don't even realize how good they're meant to feel, how you're not supposed to have low energy, how you shouldn't have to rely on coffee to get through the day, how you shouldn't have headaches or digestive issues or, you know, just feeling overall sluggish or brain fog. All of these things signal that something is wrong in your body and needs to be supported. Great question. So yes, it's such a challenging time right now for everyone. And I think it's very important to really keep your spirits up and not get too pulled into all the negativity surrounding what's happening in the world. And something that I love to do as a daily practice is to keep a gratitude journal, or even just go through in my mind a list of things that I'm grateful for on a daily basis. And this really has the power to rewire your brain and focus on more positive thinking. And I think, you know, your thoughts are going to profoundly influence the way that you feel. And over time, you can really train yourself to get into a consistent positive mindset, and that has incredible effects on your immune system, your overall health and wellness, and just how you feel emotionally. And one thing I love to remind myself is that what you appreciate appreciates. All right, so my recommendations for healing postpartum. I actually want to highlight this product by Matana Organics, Postpartum Recovery Sitz Bath. It's herbal. The ingredients are completely pure, organic, and amazing. And especially for vaginal delivery, a sitz bath is key for healing the tissues, and I certainly used it immediately afterwards. You can also make a peri-wash and just keep a bottle next to the toilet, and you can spray after urinating. And this is something that, you know, especially if you have any tearing or if you needed stitches, it's going to be very helpful in healing the tissues and repairing them quicker. So this is a great one. Another thing that I love to recommend post-birth is an herb called shepherd's purse, and this helps with the uterus to shrink back to its natural size. And it also really helps to control bleeding as well. So talk to your herbalist or naturopath or whoever is caring for you through this time, and they can guide you on proper dosage. But this one was key for me, and I know any woman at risk for hemorrhaging, this herb is very valuable. Now, if you had a cesarean section, one thing that's really good for helping with the scar tissue and minimize any scar from forming is rosehip seed oil. That's one of my favorites, as well as an herb called comfrey root. And how I would recommend it is in a salve, and you want to take it or apply it not directly on an open wound, but as it's healing, you can apply it and it will bring and prevent scarring. All right, what does my self-care routine look like? This is one of my favorite parts of the day. And what I do is essentially I deep cleanse my face. I'm using a company right now that I love that's all natural. It's Green Envy Organics. Okay, I carry these at my office because I love them so much. I use a rosehip seed oil combined with camellia seed, jojoba, and essential oils that I blended myself. And then I use a calendula cream that we make here at my office as well. It's got witch hazel, aloe, rose water, all very anti-inflammatory. There's comfrey for skin cell regeneration. And then once my skin is all nice and hydrated, I want to then do a gua sha, right? So this little tool here is a part of Chinese medicine, and it's really good for promoting lymphatic detoxification, boosting skin cell turnover and collagen production. You will increase circulation in your skin, and just by virtue of the friction, right? And you also want to do it in a way that you're contouring your face. So I could definitely do a whole tutorial on this, but quite simply, you just want to massage, go across your scalp or upwards. You want to contour your cheekbones, okay? And you also want to contour your jawline. And then to really encourage lymphatic flow, you want to go downwards on the neck, and you can also go across your chest. But yeah, I could do a full tutorial on this another time. All right, so morning sickness. I definitely had it. It can be really, really tough, especially in the first trimester. Depending on your constitution, ginger might be helpful because it's. What I also found to be helpful is vitamin B6, acupuncture. That was what really worked for me. You just may have to do it a bit consistently and discuss with your naturopathic doctor what protocol is best for you, especially during pregnancy. I did have a slight tear during delivery, although it wasn't much and it didn't require stitches, which I'm so thankful for. What you can do is a perineal massage leading up to delivery, and actually the midwives were very good at applying coconut oil to my perineum as I was giving birth, just to make sure tissues are expanding. And what is very important is feeling your birth, because that does keep you aware in what's happening. And if you have a good midwife or a good OB, they'll actually coach you into when to push, and you don't want to push too hard and too fast. You want to let things gradually expand, and it hurts so much. There's nothing easy about giving birth and being able to feel it, but I would say it's worth it in a lot of ways if you feel like that process resonates with you. And I'm certainly happy that I chose no epidural, and I think it just made for a easier recovery, and I definitely felt when to push and when not to. Ooh, great question. I have a lactation formula or tincture that I have been taking the entire time breastfeeding, because there are wonderful herbs that support milk production, quality, and fat content of the milk. So the herbs that I used were borage, fennel, fenugreek, blessed thistle. Those were some wonderful ones. And I also even made a lactation cookie that I really enjoyed, and I'll actually link that for you.